So I'm very pleased today. We're joined by Dr. Cameual Wright, Chief Medical Officer of CareSource. But today we want to chat a bit about that connection of hunger and health. You know, we have thought more and more as a Gleaners organization about the connectivity between the food people eat, or for some chronic health conditions, the food that people don't eat. Would you share a bit with us about why that is such an important theme for us to focus on?
Food is our source of energy. It's where we get our nutrients, it's where we get our vitamins. And when we don't have that food, as you can imagine, our bodies start to deteriorate. What we know physically is that if you're not feeding those vitamins and those nutrients to your body, your organs will start to shut down. So you'll start to have wasting of your muscles, you'll experience bone loss, you won't have the strength that you should have for your frame. I think the psychological ramifications are even more important. So hunger has a tremendous effect on the brain. In children, it can show up as hyperactivity. We can label it as ADHD, poor school performance, and that can be very, very devastating. In adults, it's important to understand that that can be devastating as well. If you have a job that has serious responsibilities, and one that you could injure yourself or others, then being hungry can have very devastating consequences.
We think about it at Gleaners as a whole household challenge. We really think of family units or households in terms of food insecure because you don't have one member of the family without food and the others do. So
one of the additional consequences of hunger is that our immune system starts to work less well, and we start to be at risk for things that normally we could fight off. And we're also starting to learn that the incidence of chronic disease, particularly diabetes and things of that nature, also increase after periods of hunger. So you start to prioritize your basic needs, and then things like your prescription for those chronic diseases don't happen. Doctor visits don't happen. Other things that would promote wellness take a back burner to you meeting your essential needs.
And, you know, I'm glad you mentioned the chronic diseases. Actually, consistently, the data shows that the food people eat, that mix of food, has more impact on the top 10 chronic health conditions than household income or any other factor. It's so important. We also are trying new things in partnership with hospitals and healthcare companies and so on. We're doing a test here with Humana Healthcare and cardiac patients, for example, where they literally prescribe the food that we deliver.
Well, I'm glad you brought up food as medicine because I think that is really critical. And I think that you're absolutely right. It is important that healthcare companies and others join alongside of you to really help to raise the nutrition in our neighborhoods. And I think that that's a first step. I think that we need to get into the neighborhoods and we really need to look at what food is available in those neighborhoods. So there are many neighborhoods that don't have grocery stores and they rely on convenience stores for their food. And unfortunately, we know that the food at convenience stores are not always the healthiest. And if there is healthy food, they're oftentimes very expensive and out of reach for many of our members of the community. So what we need to do is we need to develop avenues in our local communities for safe and healthy and affordable food. In Indiana, typically about 12% of our citizens experience food insecurity, and that number has increased since the pandemic. So there are people by virtue of race, ethnicity, socioeconomic background, geography that are disproportionately affected by hunger and food insecurity, and thus by the chronic diseases that are a result of that.
But I think there's also a question there about what new and different things might we try to better reach parts of our population that we're missing.
I think innovation is key. I think collaboration is key. Joining with those individuals who are already well embedded in the community, have the trust of the community, are able to speak the language of the populations that they serve, I think are really critical. And keep pushing that envelope.
So I want to ask one last question. So to give you the last word to close us out, if I could.
Yes.
We set out over 5 years ago as Gleaners to change the conversation in this community. But there are still some out there, donors that invest in healthcare or invest in relieving hunger. Is there a last word you would share to sort of drive that point home?
What we need to understand is that it's all interlinked. So the healthier citizens are, the more they will be able to contribute to their communities. And this is a great area to do investment and to watch that investment grow and benefit the entire community.
Cameual Wright, thank you for being part of this segment.
Thank you so much for having me, and thank you for bringing awareness to this important topic.